Welcome to Lesson 9 of the Family Caregiving Program, Oral Care, Feeding, and Nutrition. I'm Dr. Thomas Scotton's avatar. These lectures are for educational and informational purposes only. They do not constitute medical advice, therapy, or diagnosis. All caregiving decisions should be made in close consultation with the individual's physician and qualified healthcare professionals. Our goal is to help you support safe, dignified meals and effective oral hygiene while recognizing warning signs of swallowing difficulty. We'll learn to prepare a safe mealtime environment and recognize signs like coughing or choking that require immediate attention. We'll also cover individualized positioning, bite size, twice daily oral care, and how to communicate changes in health. A meal is more than just nutrition. While it provides calories and fluids, it also carries memories, culture, and connection. Oral care protects comfort, taste, and the ability to eat. Our goal isn't just to finish a plate, it's to support the person safely. Use the least assistance necessary. Set up the tray, open packages, or guide their hand before you begin feeding directly. Always ask permission and offer choices. Sit at eye level and allow plenty of time. Never treat an adult like a child. Before the meal, confirm the person's current instructions. Some eat a regular diet, while others need texture-modified foods. Confirm allergies, food restrictions, and whether medications affect appetite. Never guess at a texture level or thickener. A speech-language pathologist evaluates swallowing, while a dietitian helps with nutrition. Never crush medicine without professional guidance. Do not offer food if the person is too drowsy to stay awake, cannot sit in position, is vomiting, or has breathing difficulty. Pause and obtain clinical guidance. If the swallowing plan seems unsafe or is missing, do not improvise. Safety comes first. Prepare a safe and dignified mealtime. Begin with hand hygiene for both you and the older adult. Check the tray instructions carefully. Ensure dentures, glasses, and hearing aids are in place and comfortable. Reduce distracting noise like television when concentration is needed. Check that the food matches the ordered texture and that hot foods and drinks are at a safe temperature before serving. Position the person as upright as possible, ideally close to 90 degrees, with the head centered and well supported. Feet should be supported when possible. If the person eats in bed, raise the torso according to the care plan. Never feed someone lying flat. Place the food where it can be seen. If vision is limited, use a clock face description to help them locate their food. Encourage self-feeding first. If direct feeding is needed, tell the person what you're offering and approach from the front at eye level. Offer a small bite and wait for the mouth to be ready. Allow them to close their lips around the spoon naturally. Give one bite or sip at a time. Watch for chewing and a complete swallow before offering more. Never rush the meal. Keep conversation pleasant, but avoid asking questions while food is in the mouth. This helps prevent accidental choking. Watch the person's breathing. Fatigue can make swallowing less coordinated, so allow for rest breaks as needed. Check for pocketing food remaining between the cheek and gum. Signs include a bulging cheek or food falling from the mouth. Ask them to clear their mouth using a recommended strategy, like an extra swallow. Never perform a blind finger sweep. Remember the cycle. Small bite, wait, watch, confirm the mouth is clear, then the next bite. Provide oral care as directed after eating. Record intake when required by the care plan. Use specific measurements rather than vague descriptions like ate well. Coughing during or after eating is a warning sign, but it doesn't always prove aspiration. Aspiration occurs when food or liquid enters the airway. Some aspiration is silent. Watch for a wet or gurgly voice, watery eyes, recurring fever, or unexplained weight loss. If the person coughs but can breathe and speak, stop offering food. Encourage them to keep coughing to clear the airway. Do not give another bite or drink to wash it down. Keep them upright and report repeated events for evaluation. Call 911 immediately. Provide age-appropriate choking first aid only if you are trained in following emergency instructions. Call 911 immediately. Provide age-appropriate choking first aid only if you are trained in following emergency instructions. After any choking episode, follow clinical guidance. Watch for new fever, chest pain, or confusion, which require prompt assessment. Keep the person upright after eating. Your plan might specify 15 to 20 minutes, though many protocols recommend at least 30. Do not recline them immediately after the final bite. Before leaving, check their comfort, breathing, and mouth clearance. Good oral care reduces plaque, mouth pain, and the number of harmful organisms that can be aspirated into the lungs. Assist with brushing twice daily using a soft toothbrush and fluoride toothpaste. Encourage the person to brush first if they can. Brush the outer, inner, and chewing surfaces gently, especially along the gum line. Clean the tongue and between the teeth daily. Wear gloves if you may contact saliva or blood. Always clean your hands before and after providing oral care. Dentures require daily care. Remove them gently over a basin of water to prevent breakage and clean with a denture brush. Clean the gums and palate even if there are no natural teeth. Store dentures in cool water overnight unless directed otherwise. Look for mouth pain, bleeding, white patches, or dentures that no longer fit. Arrange for a dental evaluation if you notice changes. Dry mouth is common but can increase decay risk. Review medications with a clinician as many contribute to this condition. Nutrition risk often appears gradually. Watch for unintended weight loss, looser clothing, or reduced appetite. Other signs include fatigue, weakness, or dark urine. One poor meal isn't the whole story. Look for consistent patterns. Offer nutrient-dense foods that fit their culture and medical needs. Make the setting attractive and offer fluids regularly. Do not pressure the person to clean their plate. If intake declines, ask about pain or nausea and report it to the care team. Let's recap our 4 key takeaways. First, watch for coughing, choking, a wet voice, or food pocketing. Second, keep the person upright after meals. Third, provide oral care twice daily and after meals as needed. Finally, use the prescribed food consistency, small bite sizes, and a slow pace. Never rush a meal. Let's test what we've learned. Get ready for question 1. Question 1. The person coughs after a sip but can speak strongly. Do you offer water to wash it down? Pause and decide. The answer is no. Stop intake, keep the person upright, encourage coughing, observe, and follow the care plan. Question 2. What is pocketing? Think about the signs we discussed. Pocketing is food or residue remaining in the mouth. Wait. Use only prescribed clearance strategies and never use your finger. Question 3. How long should the person remain upright after eating? Consider the general guidelines. The minimum is typically 15 to 20 minutes, but follow the individualized plan as many protocols advise at least 30 minutes. Question 4. How often should teeth be brushed? Think about the daily routine. The answer is twice daily with fluoride toothpaste, plus mouth care after meals as needed to remove any food residue. Question 5. What signals a complete airway obstruction? This is an emergency situation. It signals when someone is unable to speak, breathe, or cough. Call 911 immediately if you see these signs. Safe meals are not measured by speed or an empty plate. They are measured by dignity, comfort, and observation. Thank you for the care and partnership you provide to your loved one every day. You're doing a great job. Thank you for completing Lesson 9. Don't forget to download your workbook at famcareclass.com for all our reference tables. I look forward to seeing you in Lesson 10, where we will discuss toileting and perineal care. See you then. For more resources and support, visit our website. This has been Lesson 9.